behavior modification specialist. And I am here to present to you the coping strategies for parents who usually have ADHD child, and then what to do at the particular time. You know, we teachers, we LSAs, sometimes when it comes to an ADHD child, we tend to get too much worried about some certain things. So there are some certain strategies to use to calm their behavior down. So the introduction says, what is ADHD? You know, so living with ADHD is, it's kind of difficult, I must say. So, but then there are some strategies and symptoms that we could see in the life of the child. And it is more of challenging. So it is more important for you to get support from different varieties of people, you know, those who understand what ADHD is all about. This week I met a parent and she was like telling me her son was having this kind of symptoms and she doesn't know how to do that. She knew that the son is hyperactive and not focusing, but she does not know what ADHD is. She doesn't even have any idea of what ADHD is until she started realizing. And now she said she's going to a school, like she's attending a class for ADHD because she doesn't understand what ADHD is. That before she's always screaming on the child and yelling on the child. But now that she now gets to understand that ADHD is a kind of disorder. So now she knows that the son needed help. So, and she feel like she needs to do everything to help the son who is an ADHD plus autism. So what is ADHD? What is ADHD? We've been hearing ADHD, ADHD. It is attention deficit hyperactive disorder. So it is like a common mental disorder that affects children, most especially children from started from 2 to 14 years. Yeah, and we still have ADHD in adults. It is very possible to have an ADHD as an adult. I've seen it. An adult came to me for consultations and she was like, oh, I am an ADHD. My mind is wandering everywhere. Now, we do not want this thing to spread to adults. So right now, if you can, take assessments to understand your child right now, it is very possible to correct it, not to go into the adult stage. But usually most parents don't really tend to do anything because they don't really understand, or will I say they need to accept the fact that their child is ADHD. They are in denial that their child is ADHD. Mostly that is why people let it get to that adult stage and they wouldn't do anything in between the stages as they grow up into the adulthood. So parents usually, be in denial of ADHD, of autism, of whatever diagnosis, and it's okay because, mommies, their worries, like, how can I have a child and they have this disorder and disability, and they feel like, oh, will they accept my child the way it is, or the way he is, or the way she is? So now I've come to create an awareness to you all parents. It is not a disease. ADHD is not a disease. It's just some kind of disorder, but it is their ability and their strength. Mostly ADHD children, they are very smart and intelligent. The way they learn differently from their other friends. So it is not a disease, or it is not something that you should get worried. all they just needed is help and support, prompting them. I myself, my son is ADHD, but I have already accepted. Usually, most people tell me, "Oh, why will you say your son is ADHD?" Because I know it's ADHD, but some other parents don't want to accept the fact that it is. They were like, "Oh no, you can't say that your son is ADHD," but me, I know it's ADHD. So the earlier, the better we support them now, the better for us when they grow up in the early stage of their life. So attention deficit disorder, ADHD in children. We could see in the slide lineup, it could be in different range. We can have ADHD plus ODD. What is ODD? Oppositional destructive disorder. We can have ADHD plus specific learning difficulties. Specific learning difficulties can be the child can have dyslexia in between dysgraphia, dysgraphica, can have writing delay, can have. So when you have a child with ADHD and you feel like this child cannot write, he has difficulties in writing, it is not because it's just ADHD, but ADHD is attached to other symptoms or other disorder as well. So it is time for you to understand that when the child has ADHD, it can also be combined with other, specific disorder, not all. So with children with ADHD, they can also be combined to autism. Like the parent that I met 3 days ago that I was telling you about, the child was diagnosed ADHD plus autism. Yeah, the children can be combined with two different disorders at the same time. So we have ADHD plus anxiety. The child can have anxiety, the child can have OCD, obsessive compulsive disorder. You can see your child, feeling, "Oh, I need to wash my hands." Your child can wash his hands like 20 times in just 1 minute. And you start feeling, "Oh, is this normal? Is this normal?" How my child is like, they're so sensitive when it comes to touch. And so, yeah, those are the symptoms, but not all the symptoms here. So, but they have with specific symptoms, with specific disorder. We also have developmental coordination disorder. So they might have developmental delay in between. They are also gifted. They are gifted. So ADHD plus gifted child. If you understand what gifted child is, children who highly intelligent, and their motivation skills on high level, and they can do many things at the same time. They are so resilient. Sensory integration disorder. When it comes to sensory integration disorder, sensory ADHD child, they are prone to sensory needs. They want to feel, they want to touch, they want to smell, they want to taste, visualization, they want to see. But if you don't understand this as a parent, as a teacher, it will be so difficult to manage ADHD child. But if you could understand all this specific learning disorder and disorder itself, like auditory processing disorder, depression, if you could understand that an ADHD child sometimes can be depressed because of their mental regulations. Yeah, depression can set in. So attention deficit disorder, they can also be combined to what? Hyperactive disorder. Hyperactive disorder. So when you say ADHD, it's not just only my child is hyperactive only. When your child is ADHD, is hyperactive and the inattention deficit disorder, they're usually not always focused, and their mind is always wandering everywhere. They don't have a stable mind. Yes, they know what they are supposed to do, they are not focused. They don't have focusing skills. So look, these are the signs of ADHD. They are easily distracted. They forget things. You can tell them something 20 times. Okay, you tell your child to do something over and over again. He keeps doing the same mistake. So they forget things. It is not because they are stubborn or they don't want to understand, but it's because of the disorder that they have. So these are when you see these symptoms, just know that you should go and do some assessment and diagnosis. So they are easily distracted, they're dreaming, they forget things, they cannot sit down for 1 minute, they're already up with another thing, they talk too much, and they take risk in behavior. They explore different behavior things. They can do anything and without not thinking that is this right or wrong. When I say they do a behavior, they do explore many behavior issues in the school or at home without thinking that this is right, this is wrong. And they are not patient. An ADHD child, you tell them, oh, you need to stay on the line to line up with other students. They cannot stay for 5 minutes lining up. They are already leaving that space to another space. So inattentiveness. What inattentiveness means? Says staying on task, focusing, and organization. So we have like 4 diagnoses of what ADHD is. For from 5 to 17 years. So these are the symptoms that we can see for a child who are inattentiveness. So they don't pay close attention to details. They make careless mistake in the school. Yes, they don't pay close attention when instructions is given, even in school or at home. They don't pay close attention to it. They make mistakes. They are so careless. So careless in the sense that they cannot keep things in a organized manner. So if probably they have like presentation to do in the school, or they have like something important to do, they usually make mistakes there and they're very careless. They have problem in focusing on tasks and activity, such as doing lectures, conversation, or long reading. So with ADHD child, the ability for not sitting for long already makes whatever class you are teaching them, teacher, please get noted. You cannot keep ADHD child for a long time on a chair. For your class section is 30 minutes and you want the child to sit down there for completely 30 minutes for an ADHD child. It's not really possible. So in this aspect, what do you do? What do you do in this aspect? It's just breaking the 30 minutes. In between the 30 minutes, let there be a lot of breaks, set your timer. If the child wants to go out for a break, for example, you can just teach the child to sit for 2 minutes, gradually, slowly, you adjust the timing. You let the child to sit for 2 minutes. When the child is sitting for 2 minutes, you give the child a break to go out for a break, then bring the child back again. The same method you are going to apply throughout the section, the 30-minute section of the class. You can give different breaks in between, but for you to let the child to sit and focus for 30 minutes, the child won't focus. You would be very surprised that when they go outside for a break and they come inside, they easily grab whatever the teacher is telling them because they are very, very intelligent. They're very intelligent. They easily grab because you're going out for a break with them, not to go and play, but to go and calm to relieve their nerves, because they cannot accumulate a lot of information, process a lot of information at the same time. So they needed that break to go out, to calm their brain down, to reflect. And then when they are outside, give them their break. Do not teach them. Only when they are going outside for a break for a long time, maybe they are going out for a break for like 10 minutes, then you can, let them regulate whatever they have learned in the class. But if they are going out for a break for like 3 minutes break off or 2 minutes break off, allow them to have their own time, reflecting upon whatever that is going on in their brain. So an ADHD child does not, an inattentiveness, it's like does not seem to listen when spoken to. Yeah, they don't listen because their mind is somewhere else because of what is in their brain. So in this case, I'm still going to speak later on. It's meditation. If they don't listen, you can, keep them in a place, in a quiet place to meditate for like 5 minutes. And then redirect them back to whatever instructions you are giving to them. Remember, they cannot accept all information at once. So whatever you're going to be telling them, it has to be short. You have to break it word for word for them. They cannot hold information for a long time. So you want them to get you to listen. You need to practice that meditation skills with them as a parent. As a teacher, you need to give them their time, 1 minute, and then go back again to give your instructions that you need to give to them. And where they're able to accept your instructions, you positively reinforce them. ADHD child like positive reinforcement, reward, praise. Oh, good job. Oh, good listening here. You're doing, oh, great job. Bravo. Excellent. High five. All this, they love it. So once you're able to, give your instructions and they're able to immediately listen, encourage them by positively reinforcing them. So it says, does not follow through on instructions and does not complete schoolwork chores. I think I've explained that does not follow instructions. They don't complete schoolwork, because they are usually lazy. And there are some strategies that you can use for them. I'm going to explain later on how to make sure that they're able to, do their work without not losing focus. So like everything about them is center and work and play. It's like work and play. So they are meant to do their activities, housework and everything for you. Maybe you time them for 30 minutes. It is very important for you to always give timer on an ADHD. Get your timer, parents get your timer, teachers get your timer, LSs get your timer, whatever professions you have, get your timer on. Always time them so that they will know that they are on timer and they will be able to what? Start and set up their track mark. They know that, oh, I am 20 minutes timed to complete my assignment, to do my housework, to do all these things. So, and they knew that when they are on timer, after 20 minutes, they are getting their reward. I teach my students because I teach my students ABA. What we call in ABA is preference assessment. We know what preference, we take assessment of what the child prefer, the most preferred. And when we see this child most preferred assessment, we use it as a motivation for the child. Like I say, as a parent, as an adult, as a teacher, how will you feel when you go to a work and they don't pay you salary month end? You won't be motivated. Or how will you feel you're working very hard and you don't have promotion? they're not giving you recognition. You will feel like, oh, I am working hard and nobody's seeing me and all that. But with them, they need all this reward, praise reward, food reward and all those things like that. Usually what parents do is to set a token board or a what's it called, list sheet for the child and say, okay, Mohammed, if you complete your assignment for 20 minutes or you do your astros for 20 minutes, you will get your what iPad. And mind you, you already conducted a preference assessment and you knew that your child loves iPad so much that, when it comes to iPad, he's going to listen to you immediately. Like I have my son, I told you my son, he loves cars. I will tell him, okay, do this, first do this, and then you can get your car, your favorite car. He's going to immediately complete every task I ask him to. It works like magic, like magic. You want your child to do this, to follow instructions, you set your timer, you set your token board. If you cannot do token economy board, you can do first and then board. First, okay, do this. After 20 minutes, then you can get your reward. That reward don't just come naturally. You must have conducted your preference assessment to know what your child is most preferred items, reinforcers. So when you see that this is the most preferred reinforcers, you can use it as a motivation, as a manipulation for the child to be able to get you seated to do whatever you want. An ADHD child that don't sit for a long time, but when he's motivated on iPad, can sit to complete the assignment for 30 minutes, and then you immediately give the child the reward. They have problem organizing tasks. For instance, they don't know how to manage time well. They are messy, they are disorganized, they miss deadlines. Yeah, for children like this, they cannot stay on task, they are so disorganized. They don't know how to tidy up, when they are eating, everything is messed up everywhere. It's your duty and your responsibility to always remind them to tidy up, to clean up, to organize their books, to do this. It's about consistency, telling them, do this, and then as they are doing it, keep giving them reward, keep reinforcing them. Even after the tidy up, give them their preference assessment, give them their what motivates them, reinforce them. Oh, good job. You did a good job today. This is what I have for you. Oh, you did nice working today. Here we go. Oh, you are good to go. Excellent. I love how you organize your books. I love how you set your table. I love how you clean your worksheet. They want you to always praise them at every point in time. So hyperactive, impulsive disorder. So hyperactive, impulsive disorder can be in so hyper when you say something hyper when a child is hyper energetic and enthusiasm, always running, screaming, exercising, they can't sit still, they talk too much. So those are the things that they do. So for all these diagnoses, it could be they fidget a lot, they fidget a lot, they cannot stay in one position for a long time. They run, they climb, you can see them, they can climb the table. When you see all these things, you should know this is ADHD. They can climb on the table, they can run under the chair, they can play, they cannot play when it is, they can't play quietly, they shout, they just move around, they talk too much, they can ask questions over and over again. My son can ask questions like, can ask same thing 20 times, same thing, because they just want to talk. They just want to talk. So they are not patient, they're not patient. They're not patient at all. If you don't answer them, they get tired, they get exhausted, and they get angry because you don't answer them. There's a child I have that I used to have in school back then. The child will be like, when the child is raising up the hands, close the door. When the child is raising up the end, the teacher, when it comes to school, you need to follow everything. Everything is routines and timetable and able to, understand and follow the class routine. Obviously, you raise up your end. You need to wait for your turn for the next student. But they are so very impatient. When they raise up their hand, they want you to call them immediately. And if you don't call them, they get angry. And ability to be they are so impatient. They are not patient at all. So they have difficulty in waiting for their turn. They have difficulty in waiting in the line. Combined type. So this type of ADHDs are diagnosed with inattentiveness and hyperactive disorder. So like we all said, ADHD is a mental health provider. So those people who need to diagnose the ADHD are the people in the psychiatric evaluation, people, the caregivers, to understand the symptoms, of an ADHD. The parents should take note, the caregiver should take note, the teacher should take note, the LSA should take note that this is a mental cognitive behavior, mental health thing. And they mustn't take it to heart. So we are going to watch video now to. So I don't know if you can still hear me.
Yes, we can hear you, ma'am.
Okay, thank you very much. So just play the video now.
An estimated 8.4% of children and 2.5% of adults experience attention deficit hyperactivity disorder, or ADHD. Understanding the symptoms might be harder in adults than in children, as most ADHD symptoms are behaviors that everyone struggles with once in a while, like forgetting to pay the bills, spacing out during a conversation, or missing school or work deadlines. However, in ADHD, these are more constant and disruptive. Inattention, impulsivity, and sometimes hyperactivity are key symptoms. These symptoms usually occur together. There are three major types of ADHD: hyperactive or impulsive, inattentive, and combined. The hyperactive impulsive type is the least common. The inattentive type involves mainly inattention and distractibility. The combined type is the most common and is a mixture of all the symptoms. Without proper diagnosis and treatment, ADHD can lead to chronic fatigue, depression, emotional outbursts, or performance issues at work or school. ADHD may look different from one person to the next. So, understanding possible indicators and negative effects of ADHD is a key step toward receiving necessary support and starting the recovery journey. Types of treatment include therapy, medication, or a combination of both. The goal of treatment is to improve symptoms and to restore functioning and performance at home and work or school. If you suspect that you or someone you know has ADHD, talk with a healthcare provider who will perform an evaluation and discuss treatment options. For more information about diagnosis and treatment throughout the life and
Okay, I believe we understand the video that we just watched. So what are the ways to cope for parents of children with ADHD? Literally, we've been talking about ADHD, how it's being done, what are the things to do, what are the things not to do, the symptoms, how to react to them, all these things. So now we come to what the ways to cope with parents of children with ADHD. The ways to cope for parents might not just, if you're not even a parent with a child with ADHD, you are an LSA, you're a teacher, there are ways that you can cope with them. Caring for a child with ADHD, of course, you need to care for them because of their disorder. So you need to understand that every day of their life is very, very impulsive and it's hyper. So you need to make sure that they are staying on activities and they're on tasks to make sure that they are not exhausting themselves too much. And even if they exhaust themselves, they can be able to calm down their nerves and sit quietly when they needed to stay on task. So it is also important for them to know, to be able to, find it, to suppress whatever they are doing, before the consequences. There's an attention, there's a behavior that occurs, and the consequences is to make sure they understand that, oh, these are the consequences and these are what you need to do. So also you can reach out to people that know more about this ADHD, and they can give you strategies on how to work with them. So what are the ways to cope with them is plan the day so that your child know the aspects of their day. In the school, this is what we do for an ADHD child, because they are kind of visual. Yeah, they are prone to visuals. What we do for them in school, we don't use timetable that, it's written in a worksheet. We use visual timetable because they are more prone to visuals. And then when we use visual timetable, we use their pictures. Yeah, we use their pictures. We use live pictures, and some people use internet pictures, but I prefer live pictures. We use live picture, we take pictures of them and then laminate it and put together to set a visual timetable. So when they come to school in the classroom, they can be able to understand that, oh, first they need to sit down and play with different activities. Then later they can have their phonics, they can have their maths, and then when one subject is over, you need to tell them, oh, now we are having maths. Now we are having maths. Phonics is finished. Now we are having maths. So this is now, it says set routine so that the child can know how to cope. Because if you don't set routine, if you don't tell them, their routine of the day, they will tell you, I need to go home now. I am tired. Because you need to carry them along. Or it is time for break time, it is snack time, it is lunch time. You need to go out to gym for sports activity. They are already seeing it in the visual timetable because you already take pictures of them while they are doing it. Or it is time to do this, it is time to do that. So this can be a good strategy to cope with them by setting a routine plan. If you are a parent here, you can do a to-do list in the house, do a to-do list, staple it on the wall, and just let them go through it, that when they wake up, they need to tidy up their bedroom, they need to do this. Yes, let there be a routine, let there be a plan, let there be a list of what they need to do for that day. So, yeah, set a clear boundaries, make sure that, you have your boundaries set already. So make sure that all behavior is expected, be clear in your instructions, in whatever you want to do. So if they are not being able to do whatever you ask them to do, be clear with your consequences, that, if they don't do what you ask them to do, they won't get their, for instance, now, I'm saying at home, if they need to do some housework, like clean their house and sweep the house, and then after sweeping the house, what is next on your to-do list is to go outside and play. You already have a to-do list already. Is to go outside and play. And then you give a list, a routine to clean the house, and they didn't clean it. Then you are going to tell them that, if they don't clean this house, they will not go outside to play. So they need to work to clean the house and then hand their rewards by going out to play. So that is setting a clear boundaries on what they need to do. Be positive, give praise, or reward them when they do, even as they even try to do some certain things. Praise them, reward them. Oh, good job. You washed the dishes nicely. Thank you. This will make the child to be more, willing to do more. giving instructions. If you are giving instruction, be brief in your instructions. Like I said in the beginning, do not choke them with so many information. Do not choke them with so many things. It's just like, oh, please put the toys back in the box. Oh, can you help me with this? You know, don't say too much long sentences. Be clear in your instructions. So this makes the child, you know, have other opportunities as well to be able to, you know, understand their need. Incentive scheme. So what is incentive scheme? Is by using your, I think I've said it before. At home, we can use house points. Yeah, most parents use house points. House point to set it, you can put it or chart. You can put it anywhere in front of your fridge, you can stable it in your wall, you know, just take whenever they do something nice in a day, just tick, 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 tick. At the end of the day, you reward them with either by KFC, or you reward them with, oh, we are going out to play on swimming pool, or whatever, pizza, or whatever you feel like you want to give them. In the school, as a teacher, we normally have the star charts. You know, as a behavioral therapist, as a LSA, we use token economy board. Okay, we use token and economy board. It can be 10 tokens or 20 tokens. Tokens are an exchange of whatever we want them to do. These tokens, they are tokens, but it's an exchange of an reward. So what are you working for? I am working for iPad, or I am working for I am working to go to sensory, anything that can motivate them, that is their preference assessment. I am working to go out to play. Okay, give me 10 tokens and then you can go out to play. So whenever the 10 tokens are finished, then they are reward. Oh, good job, you finished. Then you can go out and play. So these are reward kind of reinforcement, so that they can be able to earn something. For example, behaving well on a shopping trip, you will earn your child a computer game. You know, that is a reward. You know, involving them helps them to understand the need that, you know, they are what? They are staying on the right track. I explain house points and token board and sticker charts. If you have a sticker chart, mostly they use sticker chart in the school. A behavioral therapist use token board, and then house points is usually used in at home. That's why it's called house points. So there's an house point on the wall chart. You know, they can have 24 house points. You know, you can give them 10 house points. So if you have 10 house points, the points are counting. Whatever behavior, if you behave nicely, you have 1 point. If you don't behave nicely, you don't have points. So if you behave nicely, the child will go to the chart. You carry the child along to go to the chart to tick, or because you did very well today. Oh, you gave your child to wash the dishes, and it did very well. Oh, good job. Now you can go and put 1 house point. You know, you already set a goal of 10 house points. So when the 10 house points is finished, then you can reward the child, maybe to go on a shopping or to buy their favorite ice cream. You know, this motivates them and it helps them, you know, to do their tasks right on time. So this helps them intervene early. Intervene early. This is what we call in ABA, we call this antecedent intervention. What is antecedent intervention is, you know, to know what happens before the behavior and then intervene, try to redirect the behavior not to occur. For instance, if I see my child is going to get angry or cry or yell because of these certain things, how do I do it? I redirect the behavior not to occur. So intervene early means that, you know, you already know the signs of your child. You know that they can become frustrated, they can be overstimulation, you know, they can have self-control. So what do? You intervene. You distract your child. You know, if you feel that your child is too much hyper, you know, too much hyper, running around and trying to because when they are hyper running around, it can lead to tantrum and or meltdown. So what do you do? We don't want it to escalate, you know. So what do? We can just take them to a quiet place, play a nice music, to sit down quietly, you know, just tell them to sit down for 5 minutes. So that is being intervening earlier, like you intervene early. You have a child, your child is, in the school, this child loves to go to other child and, pull their hair, that your child pull this other child's hair. As an LSA, what will you do? You're sitting between the child so that you can be able to intervene. This is what we call antecedent intervention. That is why you need to observe your child. You need to observe your child, take observation notes, to understand the needs of your child. So that when you know that after 10 minutes, your child cannot do without pulling the next child's head. You understand? So what we do, you intervene by sitting in between the middle. You don't even give any chances. The teacher might not understand this, but as an LSA teacher, you need to let them know that, you don't want them to pull, because it might not be allowed to sit in between the children in the classroom. It might not be allowed, but you can explain to the teacher nicely that, you need to do some antecedent intervention because you already observe your child that, this child cannot sit for 10 minutes without not pulling the child's head. So what will you do? You will direct the behavior by what? Sitting in between the child and then distract the child in order for the child not to pull the hair. Probably you can give them like a fidget toys in their hands to squishy balls because I think they are over sensory stimulating. Remember, we said in the ADHD that most of the things, there can be sensory, there can be sensory integration in between. So they can be over sensory stimulating. That's why they are pulling the hair. So it's not like they are pulling the hair because they want to play. Maybe they are in the stimulating mode. So what will you do as a teacher or as a parent? You just give them a sensory fidget toys, squishing balls, just for them to squish. They squish with their hands like this to stop pull, so that the child will not pull the next person's child's hair. So that's why it's always good to intervene early. So this may calm them down. Bedtime. Stick to your routine. Make sure your child goes to bed at the same time and each night they wake up in the morning. Yeah, when you stick to the routine of your child, because with ADHD child, you cannot have an ADHD child like just to go and sleep when it is bedtime. So what are the things as a parent you need not to do as a parent is to what? Not to let them watch video games. Maybe you want them to sleep and you're ready and they've watched video games or they've watched cartoons over the night. It will be so difficult for them to sleep because you've already awakened their sensory needs. Their visuals are already open. So it will be difficult. I remember they are so triggered to anything inattentive and hyperactive. So whatever that is going to keep them in the mood, they are triggered by that. So you cannot give them cartoon to watch if you want them to sleep early, or you cannot give them video games to watch, or you cannot give them something sweet like chocolate before bedtime, or you cannot give them like a soda or juice before bedtime. So this can still help their hyperactive, and it will be so difficult for them to sleep over the night. I've seen parents complaining, oh, my child don't sleep, and they don't sleep throughout the night, and in the school they tend to sleep during the day. So these are the kind of things that you need to do. Keep to your routine. Whatever video game, everything should be on a timer. Without time, if you don't time your ADHD child, everything will just be disorganized. So you need to always time, okay, in next 30 minutes, they are watching video game. They are going to watch video game for 2 hours or for 1 hour or for 30 minutes. Next, They need to go to this. So everything should be on a routine. That's why I said we need to have a to-do list. You set everything on your wall. Let them know what they are doing, the next activity they need to do, so that they can also understand. And when you are being consistent every day, your child will master their routine and they know, okay, when it is time for bedtime, it is 8 o'clock, I need to go to bed. So if I'm watching video game, it's just for 30 minutes. You know, all these things, they will understand as time goes on. Night time, you know, because sleep is a problem with ADHD. So they don't really have a nice sleep because of their too much hyperactivity, too much a lot of things want with their brain. Their brain is always awakened when every brains are shut down, and they're so energetic. And then you'll be wondering, like, as a mother or as a teacher, I am tired, but this child is not tired, you know. He's so strong and even he still wants to play over the night. So you just need to know how to, you know, help them with their sleep pattern. You know, you can make and what they do is they just like they like they like anything being, yeah, they like anything being on. Sorry, can you hear me? Let me see. Sorry, my battery is low. Let me quickly open my charger. Yeah, I mean, can you hear me now?
Yes, ma'am.
Yes, Mary, you're able to be audible. Sorry, you're audible.
You can see the slide, right?
Yes, we can see the slide.
Okay. So that's it. Help at school. So you need to help the children at school. You know, that's why we have the Senko department, the LSA. So children with ADHD often have problem with their behavior at schools, and you know, it affects their academic process. That's why we have the support teachers to always support them in terms of academics, the Senko department to conduct their assessment for them, to give their IEP plans, to know their target goals. You know, all this really helps in schools. So you can speak to your child's teacher and your special needs coordinator to know what other support you can have for your child. So adults with ADHD. So if you are an adult and you are diagnosed with ADHD, so you might find this useful. So if you find it hard to stay organized, you know, make a list. Still the same thing as we've explained, stick up with reminders, you know, plan yourself, you know, exercise regularly, you know. Find ways to relax, such as listening to music, not just music that is so loud and shouting, but you can listen to cool music for you to meditate and relax yourself. I literally used to give this strategies to work for children as well. It works for children as well. When I feel like one of the child I've worked with, ADHD, and I feel like it's so hyper and it's so inattentive, I'll just take them to the sensory room, play a music for them, this ocean wave music to calm their nerves, take them to a quiet place. I'm going to separate them from the whole chaotic of the classroom and then take them to a quiet place and let them, meditate, relax. So because, their brain is already up and everything. So this can shut down their brain and make everything calm and okay. So listening to music is very, very good to reduce stress. So if you're at work, you can speak to your boss about your condition. So these are for the adults. So how would you calm an ADHD mind? How do you calm an ADHD mind? Because usually the ADHD mind are, they're always overstimulated. So how do you reduce the overstimulation? Is to help them focus in attention. How do you want them to focus in attention? Is by practicing mindfulness and meditation. Mindfulness and meditation. So it can be physical exercises, they can, do some exercises for them. Breathing, breathe out can be also a good exercise strategies to calm their mind. You can just tell them to breathe in, breathe out, especially when they are running here and there, they are moving around, jumping on the table, just tell them to sit down quietly, one-to-one with them, and then say, breathe in, breathe out, breathe in, breathe out. And you are not going to do it in a noisy environment. You have to do it in a quiet place. So other activities can be done for concentration is what? Drawing, painting, playing instruments. This also helps calm their mind. Calming ADHD mind strategies, listening to music. It could be noise cancellation headsets, because of a noisy environment. So it says with ocean water sounds. So it's just a splashing water, not there's this kind of sound that it comes like a wave. So it's also good. Breathing exercise timing. You set your timer for 10 minutes and you have to be intentional about it for them to breathe in and breathe out. This can, calm their mind and it will stop their mind from wandering here and there. Meditation. Meditation for 5 minutes, reduce stress and restoration. It helps them to sit in a quiet place. While they are seated, they close their eyes and they are focusing on the breathing, breathe out, breathing, breathe out. So if your child loves reading book, I've seen a child with ADHD that loves reading books. So reading book is like a calming strategy for them to calm their mind, in whatever they are doing. So reading books helps them to calm their mind, to help them stay on track, to help them focus as well. Taking a nap for 20 to 30 minutes is also important. So have you considered water play for your child? Some ADHD child likes water play, fishes in the water. I used to have my visual lamp. I have visual lamp whereby it has a lot of fishes in the water with different lightning, blue light, orange light. If you cannot get that one, you can do a water therapy at home for your child by putting fishes in the water, different coloring, blue coloring, red coloring, and all that. This also help. This also help this also help them in their water therapy. Body massage. I give body massage because, when it comes to ADHD child, they have a lot of things going on in their body, pains, maybe because of the exercise they have done too much. So they have a lot of pain in their neck, in their hand. So what we do is to do a therapy for them by massaging their body, their legs. What I do for my child before he sleeps, I make sure that I massage his legs, it's like a sort of relief for them after a long day with, hyperactiveness. It's all the energy. So we massage all their bodies, their hands. This also help them, put their body together to stay on track. Yeah, I've talked about visual and multicolor. Yeah, you can put it in a dark environment. When you have your visual lamp, put it in a dark environment, only the lighting is just going to be showing. This will help them to just focus on the fishes in the water, and it helps them in their calming mind. All these little things really helps. If you are doing it consistency, it will help them. Even in school, there are some sensory room that has this visual lamp. So I don't know, not all schools have. There are some sensory schools, sensory room that has this visual lamp in the school. So if you're at home, you can buy for your child. So taking caffeine, sweets, and sugar is not needed. So parents should not give them chocolate, sweets, sugar, whatever that is going to stir up their body, their hyperactiveness. Parents should refrain from this. So move your body and take a walk. When it is time for them to, do moving their body, maybe for 5 minutes, take a walk if they needed to time out, and then yoga, practice yoga for them. This can also help. Then we have weighted blankets. Weighted blankets is a form of a blanket that is going to help them regulate their body system whenever they have a lot of feelings like pains in their body. So the blanket is very heavy. The blanket is very heavy, and you can use it. The blanket is very heavy, and you can use it on their body. This can help them to feel the calming techniques in their body, to help them relax their mind, to calm their body down. You can use a calming environment for them to practice this. What are the benefits of mindfulness and meditation? So it enhances focus. It improves attention span and reduce distraction. So one of the issues with ADHD is attention and focusing. So, but with practicing mindfulness and meditation, it helps them with improve attention, and then it reduces distraction. So you cannot have them, meditating, and then it helps them focus. So while they are seated there, they are sitting on the floor, closing their eyes. It helps them focus to direct into the right channel. What occupation therapists usually do is after their occupation therapy with the child for 30 minutes, they always practice meditation for them, because they know that they are taking them back into the classroom or back into the school or whatever. So they are going to practice like 30 minutes or 10 minutes meditation after the whole activities, after the jumping, after the swinging, after everything. You cannot take them with that mood to the classroom. Obviously, they are going to dysregulated and so hyper. So because we want to calm their focusing skills and improve their attention span, we do meditation for 10 minutes before sending them back into the classroom. So this occupation therapists usually use this as one of the strategies for the ADHD child. So emotional regulations, observing emotions with, understanding emotions triggers, what triggers the emotions, what are the emotions regulations, what is the red line zone, what is the zone, the danger in it. So this as well, meditation help them to what? Regulate their emotions, whenever they are angry, whenever they are so hyper, or whenever they have a lot of things in their brain, they can, practice meditation. This help them reduce emotions or whatever is going on in their brain. So meditation also reduce stress. Mindfulness and meditation, it promotes relaxation and stress reduction. It helps them keep their mind, stay in one position. So it doesn't make them wander away. Improve sleep. If you are practicing meditation on your child's sleep will be improved. Because usually with ADHD child, they have difficulty in sleeping over the night. But if you are practicing meditation with them, it improves their sleeping routine and it helps their body regulate well for rest. Self-awareness. When you practice meditation with them, it enables them to know about their self. They will have deeper understanding that there are some certain things that they can do. They'll be self-aware about their thoughts, about their feelings, about their behavior. And this is not just only for ADHD child. I think meditation is just for everybody. We have gone through a lot of hard day, stress, and everything. We need meditation to always keep our mind checked, to regulate our emotions, our feelings, our behavior. This meditation, if you are doing it consistently, is going to, reduce the, you will see that your child will get better in their ADHD. So it says here, how to start with meditation. How do we start with meditation? So you start small, starting small, like 5 minute section, guided meditation. Have somebody to guide you through the meditation because you cannot do the meditation yourself. If you're a parent, you can guide your child for meditation. If you're an LSA or a teacher, you can guide the child for meditation. So you don't just leave the child to go and meditate. Both of you can do the meditation one-to-one. Create a routine, choose a day to start and be consistent with it. Find a comfortable position, not in a noisy environment, not in a chaotic environment. Just go to a quiet place and do meditation. This can also be done in the school as well. Yes, we have a lot of quiet place in the school. If you feel that your child is if you feel that your child is not regulating very well, you can take the child out and then go to a quiet place and practice meditation. Then you go to you find a comfortable position by lying down or sitting down to meditate. So it depends on you, whatever position you want to use for your child. Embracing mindful mindset is to help them focus on meditation so that their mind doesn't wander everywhere. We've discussed about this in the beginning. So be patient. It takes time. I used to tell parents, they'll tell me, oh, my child is this, my child, when do you think this can take place? When do you think this can, go on? I mean, what is the target what is the assurance that my child will get better and all that? So it takes time because all these strategies is not something that is like artificial. It is not artificial that, or it's not medicine. ADHD is not, we don't have a medicine or to help them calm down, or it is like we use natural strategies for them. And we all know anything natural is takes time. So if you are not consistent with practicing meditation, if you are not consistent in practicing any skills or strategy, if you are not patient, then you will not see results. So the ability to see results is to be patient, to be consistent, because these progress are very slow because it's a natural strategy. So you don't need to, you start a therapy section with your child with ADHD, regulation of emotions, and hyperactive or focusing attention, and you want results for 3 months. No, it's going to take like even 6 months or 1 year for you to start seeing the results showing. So you have to be patient as a parent, because this is a natural way of how we use strategies for our child. So we are not using chemicals, and you're using medicine. There's not even medicine for ADHD or autism. There's no medicine for that. So parenting strategies for children will provide positive attention. So give your child a lot of attention, positive attention. Give effective instructions for your child. When you are instructing them, make sure that you are maintaining eye contact, letting them understand the instructions you are giving to them. Praise them whenever they do something very good. Praise them whenever they are doing anything that you feel like this should be rewarded. Praise them for it. Even when you feel like this child didn't really, you didn't tell them, oh, do this, tidy up. They just do it on their own. Praise them. Sometimes you can reward them. Oh, because you did this, I'm going to give you an iPad. I think we've talked about this. Establish reward. These 5 steps strategies is what can help an ADHD child keep in check. Positive attention, effective instruction, praise your child, establish reward, use consistent consequences for them. Let them know that if they don't do something nicely, the consequences of their behavior, you are not going out to play because you didn't follow the routine. Remember, we talk about setting a routine, a to-do list. Activities, they need to understand the next activity coming up. And if they don't really do what you needed them to do, there is a consequences. So let them know, be consistent in whatever consequences you want to give them. Don't say, oh, you start with a consequences today. Maybe you didn't take them out because they didn't do some certain thing. And the next day, because they didn't do certain day, you take them out. No, be consistent with whatever instructions or whatever consequences you are giving them. 5 tips or strategy for your ADHD child. I think we've been talking about this. Give praise and reward. Again, it helps them with their self-esteem. Not every day look good. Some days are looking bad. So you just, encourage them, reward them, because there are sometimes they don't just want to do it. But once they're told, when you tell them, oh, if you do this, we are going to go out for your favorite ice cream, this motivates them to do some certain things, right? So give a clear directions and command, make eye contact, let them understand that you are giving these instructions. Healthy habits. I tell most of my parents that, you need to give your child healthy food, refrain from junk food, refrain from chocolate, refrain from sweet or vegetables, eating good things, refrain from snack. Let them eat a well-balanced diet food. Develop routines and homework chores. Develop routines, and I think we've talked about developing routines, how they can develop their routines, make them to be consistent in their routine, their checklist, their to-do list. If you're a teacher, be consistent in your visual timetable. Let them understand after phonics, we have math. After math, we are going on a break. So they cannot jump this routine. So now they cannot skip math and go for phonics. So they need to understand that after maths, they need to go for phonics, and they cannot jump from phonics to snack time. So they need to understand the routine of it. Why they are doing that, you let them watch, remove the picture chart and put it back. Because why they are doing that, they are constantly aware that they are actually following that routine. So help your child build relationship and social skills. It's a good role model for parents, for teachers. Help them, let them spend time with other kids. We talk about if you're a parent, build a strong relationship with them by at least making them have this, what they call play dates. Let them have that social gathering with their friends. This help them know how to manage their emotions and feelings well. As they goes by, as they are socializing, they know the needs and feeling of other children. So this also help them in their emotions regulation zone. So this help them get in track. So arrange every activities of children of the same age. So this also is a very good thing. So try different approach. Discipline strategies can work for children. Not all children discipline, because I think I went to one school and they were like telling me, oh, for this child, if you punish him, if you do this, if you discipline him, it aggravates, it escalates the more behavior. So they want only positive reinforcement. So why there are some child, you need to discipline them. If you don't discipline, so you need to know what works best for your child. And if it's timeout that is working for your child, continue doing timeout. If it is, not giving them some, but denying them access to whatever they need, access to tangibles in functions of behavior. Also, if it is, that is what is making them, staying on, working for you, yeah, fine, you can use it, or writing an apology. So you can use different approaches. So not always one strategies. You can try different strategies. Be patient. A child with ADHD may show the same behavior over and over and make mistakes. But you have to be patient, set rules, be firm, be kind, and be patient to your child. Be firm, be kind, and be patient to your child. Yes, you need to be kind, you need to be firm and be patient with him, because consistency is what keeps them. Because you can correct them over and over again 20 times and they are not still listening. So consistency, you are being consistent in the routine. You are doing everything to make sure that this child is staying on track. If you give up, it's going to, you are going to start all over again. But you need to make sure that you are consistent in your consequences. You are consistent in whatever positive reinforcement you are giving. You are being consistent. Like setting a clear goals, you are being consistent with it. So what are the 5 C's of ADHD for parenting? Self-control, compassion, collaboration, consistency, and celebration. Self-control. You should be able to manage your own feeling. As somebody that wants to work with an ADHD child, you need to be patient. You need to be able to understand that you are working with ADHD. Whatever that comes, you need to understand. Same thing as an LSA teacher. A lot of things will come up, but you just need to stay calm and stay put. That this child is an ADHD and you want the best out of them. So whatever you are going to be doing, you need to be patient. You need to manage your own feelings, and do not let your own emotions get ahead of you before the child. So compassion, because there'll be a time like you'll be like so hungry, just like one of the parents were telling me. So you just being able to accept, oh, this child is just like the way it is, and I am just here to help and support him, but not adding to the process of whatever that is going on with the child. Because when you show your own feelings, you are showing your feelings, the child is showing their feelings, it's going to escalate. So if the child is showing his feelings and emotion is happy, you should be able to maintain self-control and calmness and patience. You need to be compassionate. You you need to be compassionate, where if the child is, playing anywhere or not feeling very good, you need to go with your child and explain to the child and be with them. Try to, if you feel that the child is so sad, you need to go to them and, try to understand why the child is feeling sad. Consistency. You need to be consistent in whatever you are doing. Collaboration. You need to work with your child, work with your teachers, work with your SENCO department, work with your therapist, work with your occupation therapist, whatever therapist your child is going with, you need to work with them so that whatever strategies they are using in the school or in the center, you can also be using it at home. So using these 5 C's, making them part of your parenting routine. Take time to cool off when you are aggravated with your child. Show concern, your support for your child when he's struggling or when he annoys you. Talk about any problems that come up, be steady, be predictable. Even when you feel like giving up, stay positive. And this also goes to an LSA teacher and also behavior therapist, any professional out there. No matter how small, stay right there. So thank you very much. And that is the end of my presentation for today. I don't know if you have any questions. Do we have any question? Is Madia here?
Yeah, Mary.
I'll just open the floor for you to.
Sure. Mary, there is a parent who was here in the meeting chat. Ihan, he would like his question to be cleared out. And I think Christopher Shioma also has a question.
The question, please. Sorry, I can't see my screen right now.
Okay, so Ihan has a question. For the past 2 years, we've noticed that our 7-year-old son who has been diagnosed with ADHD seems to have the ability to read his mother's mind. He can accurately vocalize what she's thinking, but this ability doesn't extend to others. What could this symptom indicate, and why does he continue to possess this ability? And he is also diagnosed with mild autism.
Okay. Okay, with this kind of question, because he's diagnosed with mild autism, and the ability to read the mom's mind and emotions. If I might get your question correctly, it could be different, things that can happen at the same time. We don't want to delve into questions like this. The thing is, the observations need to take place. We need to observe the child. Why is this child doing this? Because maybe there's something that is triggering, like there's a trigger on the child, and the child is able to know the mind of the parent, and so there can be a lot of things taking place. So we need to understand, because there's a lot of things in that questions, and we need to understand the fact that we need to take observation with the child first, understand why he's behaving like that, and then we can know what strategy plan to use for that kind of child. So when it comes to mind, it needs like cognitive behavior, therapy. So to understand how the mind works. So because maybe the parent is already used to, or is used to the parent, whatever their instructions given to them. So maybe that's why he's able to do whatever he's doing. But without that, we need to still understand, taking observations, and making some assessments for the child in order for us to understand why the child is behaving like that. So if it's diagnosed with mild autism, it's something that needs to be done using meditation, mindfulness of meditation, and they need to take him for a cognitive behavioral therapy. So I hope I've answered the question. Or we can always if the Madia, are you here?
Yes, Mary.
Yes, we can always the parents can also, message us so that we can really understand the reason why the child is behaving like that, because the question has a lot of things in it, so we can be able to, so we can provide a necessary answer for the parents. So if there's any other questions, we can take.
Yes, Ihan. So, like Mary had suggested, her email address is being screen shared. You can drop her an email regarding your query, but mostly as per what you had brought up, it seems that your son has a very strong bonding with his mother. So, because of this, it's quite
Yeah.
what is it?
Yeah.
It's a quiet normal behavior for children, not
Okay.
only with children diagnosed with special abilities, but it is normal with normal children as well when they tend to spend a long period of time with someone, let it be the mother, father, a friend, a sister or brother. They learn their actions, their moves. Now, as adults, as sound adults ourselves, if we spend a long time with someone, we study their movements, we observe them and we study their movements. This happens without knowledge. Means it's not intentional. So your son, it seems from what you have told, your son possibly has studied your wife's movements. What like when she makes
Emotions, yeah.
yeah, so perhaps like when she makes, let's say, maybe if she smirks a little, he may be thinking, okay, this is what she must be thinking now, or the way she moves her hand. He must have observed her to the extent
Yeah.
where he is able to dictate her next move. So possibly this could be what's happening. But still, it would be better if you could drop an email to the to Mary. She has shared her email on screen. I'll be sharing it here on the chat as well. So with a detailed explanation, like for example, with certain examples of what are these things that he's able to vocalize after her, like what after he reads her mind. So we'll give you a detailed insight on that. And Christopher Chioma, Mary, Christopher Chioma's question is there a connection between speech delay and ADHD?
Yes, there is connection. Yeah, there is connection with speech delay and ADHD. Yeah, we can have a speech delay child and then still has ADHD. We can have an ADHD child and still have autism. So this disorder are interwoven, and they can, come in between different, ability and strength. So for speech delay and ADHD, I'm seeing a question saying how to improve speech. How to improve speech, you can organize a speech exercise for the child by what? By telling them, shaping them word for word. For instance, you want them to talk about, you want them to be able to say their name. You want them to say their name. So you need to break word for word for them. You understand? Breaking the word and not, for instance, we are talking about testimony, and you cannot just tell the child, okay, say testimony, but you need to start from syllables like testy, testy. Then, if the child is able to understand testy, then you reinforce the child by saying testy. Then money, You understand? Step-by-step process. So you can also do a kind of speech exercise, like sound exercise for the child. You can tell them to blow bubbles. Blowing bubbles can help them expand their nerves, their mouths, and for the speech to be able to come out. You can also help them improve their phonics, when saying that good morning, understanding their phonics language. It also helps as well to improve their speech, and then what we do for speech delay is speech delay child is to what? Constantly, when you are reading to them, when you read to them, you tend to read to them whatever story that you feel like they like. You can read it out for them. Also understanding vocabulary words, and then repetition of words. You are telling them, okay, say good morning to Miss Shrew. Good morning, good morning. So you must make sure that the child is repeating whatever you are saying. This can also help, in whatever you want the child to be able to understand. So I don't know if gifted and so can Madia can also answer in regards to that.
Yeah, thank you, Mary. So yes, there would be a connection related to speech. And now this depends on, if we talk about ADHD, like Mary had explained here, we have different domains when it comes to ADHD. We have the inattentive, the hyperactive, and the combined. So this honestly depends on which domain the child falls under. Now, if you're talking a general perspective, you could say that, sorry, for example, if the child is inattentive, maybe due to his or her inattentiveness, the child was not able to focus on the words that's been dropped into his or her ear. Now, we have seen children where they face speech delay due to their inattentiveness or their hyperactivity. So in the sense, when a child is inattentive, I might be reading a story, a small story, let's say a story of 3 or 4 sentences. We have these mini stories, right? So the child, like, we are reading a story that there was once a cat. The cat's name was Tom. He was gray in color. So it's a very small story for any child, but with a child with ADHD, it might be a really long story. So now when the child is listening to the story, maybe he'll listen to the first word. There was once a cat. His inattentiveness doesn't allow him to focus anymore. So the next few words, the cat's name was Tom. This does not drop into his ear. So due to this, there are words that will not be retained into the child's memory. So because of this, we have to sit with the child. It's very important to have patience. Patience is number one when it comes to dealing with any student of determination. So we have to sit with the child. We have to repeat these words again and again. Yes, the child might get frustrated. So you, as a practitioner, as a parent, as a practitioner in the field of special education, we must be able to find different methods to make sure the child, at least for 1 minute, if the child's attention span is 30 seconds, we should be able to find methods, strategies, different activities that will allow the child to sit for. There might be a little movement, yes, fidgeting, such excessive talking, these all will be there, but the child has the interest for at least 1 minute. Means his or her interest has increased from 30 seconds to 45 to 60 seconds. So let's say now we are reading this story. There was once a cat. The child starts losing focus. He's busy looking here, looking there, trying to talk to his friend. So what you could do is, you can show a picture of a cat who, for example, from the cartoon Tom and Jerry. So you can show, and you can be like, show the picture and say, meow, meow, look who has come. So that will gain his attention, his or her attention. So when he looks at the picture, his focus comes back to the topic or whatsoever story you are talking about. So same thing applies with hyperactive students and combined with the combined domains. So these all we can work with ADHD children when we try different methods. So as practitioners, as parents in this field, we have to be able to figure out different methods, different strategies to help the child out. Yes, sometimes it might be frustrating that you're trying 4 or 5 methods in a span of 10 minutes, but the child is not at all attentive. The child is not ready to sit. He's very restless. He's very infocused. So what we can do is we try different methods again and again. We give them a break. We give them a 5-10 minutes break. Okay, go talk to your friend. Okay, go have your food. Come again to the same activity, or we try the activity in a different method. So I hope I've answered Christopher Shioma's question, and I hope Mary's explanation was fine as well. Tron, what can be done educationally and therapeutically for ADHD children? Mary?
Okay, let me just add to Christopher's question as well. First, you need to observe your child. We have different kind of learning strategies for a child. Some child is kinetic learning, some child is you know they just want to move around, while they are studying. So you must understand the kind of learning strategies for your child, so you can use it for your child when you are explaining, especially when it comes to reading a story. Just like the way Madia is saying, talking about the cats, you need some child, they just want to see, visualize things, animals that is pertaining to that story. So you're talking about the cats. So you need to show them the cats, either by pictures or by bringing toys of a cat, showing them this is a cat, and then bringing different objects as well. It could be cat, it could be dog, and it could be anything, any other animals. So you can also let them understand which one is a cat. Show me a cat. So because it's not just about repeating the words, but it's by understanding whatever words they are trying to put into their brain. So whenever you're trying to explain, because as an ADHD child, it's more of visualize skills, is more of what they want to see. If you are just talking, they don't want to talk too much. Just show them the picture, show them the animals, show them, if you're talking about fruits, show them the kind of fruits. You can also role playing with your child. You can also help increase the speech. Role playing means that it doesn't have to be teaching method skills, but as the child is playing with some certain things like fruits, like mangoes, like orange, and then you say, oh, you like this orange, you like this banana, so what is this? You try to let the child understand what banana is, and then tell the child, okay, is this banana or is this mango? The child will say, oh, this is banana. So now you already know how to differentiate, and you understand that, oh, this child can understand what banana, and differentiating the child from banana to mango. So that you can be able to know that your child already can say banana and can understand banana. So whenever the child see a banana, this can make them to say, oh, this is banana. So you've improved their speech, because why? They're able to visualize things and they understand in a natural environment. So I hope I've also answered your question. What is the next question, Madia, please?
Okay, and then we have Tisha PDH. Okay, Tron, you require PDF and ADHD related notes. Yes, these will be shared to you in the upcoming sessions. I'm not sure how many of you are aware, but if you all are aware, we have the DSM-5. Sorry, we have the DSM-5 checklist. These also will be shared
Oh.
to you all in the upcoming sessions. So we are currently gathering the sheets for that. These all will be uploaded and you may get access to it. So, so the DSM-5 is just a brief about it. The DSM-5 is a diagnostic and statistical manual for mental health disorders. So these will allow you, this is a checklist basically, which will allow you to tick from a range of 0 to 4, 0 being none to 4 being the highest. This will allow you to tick the checklist of what you feel a child or a person might be diagnosed with. For example, with the ADHD, DSM-5 ADHD-5 checklist, you will be able to tick out some conditions that you feel meet the criteria, and you will be able to calculate the raw score. And this is not, now please note that this is not exactly authentic, where if you see the checklist and the checklist shows that the child has ADHD, it's not authentic. It's going to be a rough idea for you, so that you can help the parent, or as a parent you can take this to your child's healthcare provider and ask them for a finalized answer. So this will allow you to have an idea of what the child could possibly be diagnosed with. Is it autism? Is it ADHD? Is it a learning disability? Whatsoever, you will be able to have an idea of this, and you can calculate it and get the proper authentic information on what could be done next. What's the screening process? What are the medications to be taken? So these all will be shared in the upcoming sessions. And we have, okay. Again, we have Tron, who has asked how ADHD and autism are related.
Yeah. Yes, autism and ADHD are related because, some of the things that goes on in they are diagnosed, like the child that the parents came to me is autism and ADHD. So, for autism is just, um, socialization of skills, they cannot socialize, some of them, they have behavior issues in the classroom, because of whatever um, thing going on in their brain. So they in autism as well, they have so many things. Also, it's kind of similar to ADHD. Some of them have speech delay, and but they can sit down, they can focus, and they can do some certain things, but the only thing there is they just like to be on by themselves. An autistic child, they want to be by themselves, and they don't want to socialize with other kids. Yeah. So that is with autism. But with ADHD, they are opposites. They like to socialize. They like to jump different places. They are not focusing. They are not listening, and they cannot sit in a particular place. And so if you bring both of them combined together, so it could be, on a scale of a preference, which one is more higher. It could be in autism, we have different levels. We have the mild autism, we have level 1, we have level 2, level 3. So it depends on the kind of, level of the autism. So if it is the highest level of the autism, obviously the autism is going to overshadow the ADHD. But if it's just the mild autism, so the mild or the autism can be controlled, while the ADHD take over from the autistic. So this you can, if you know the level of autism of your child, is it level 1, is it level 2, is it level 3, is it mild? So you can know which strategy you can use for the child if your child is being diagnosed on autism and ADHD. We tend to see that the autism are mine, while the ADHD overshadow the autism. So you can use all the strategies that we've learned today for ADHD child. So I hope I've answered. I don't know if Madia can also speak concerning that as well.
Yeah, I hope that's clear for you, Tron. Our next question is from Shilpa. Napping is impossible for my son during the day. He has autism and ADHD. Any tips?
I don't, you said what? Sorry.
Yeah, napping is we had a question from Shilpa.
Okay.
So she says that napping is impossible for my son during the day. He has autism and ADHD. Any tips?
Yeah, that's what I'm saying. I think we've explained it in the question that you need to understand the level of your child's autism if it's diagnosed in between the two, autism and ADHD. So you need to know, is it mild autism or is it a severe one? If it is a severe one, if it is level 3, then you can focus on autism and then ADHD can be suppressed a little bit. But if it is, if the autism part is mild and it can still be managed, you should focus more on the ADHD. And those are the tips I've given to you. The strategies is both positive reinforcement, be patient and consistent in your instructions. You need to be able to reward them. You need to make them set a timer, set a goal for them, set a routine for them that get a reward chart. First, you need to do this, and then you get this, right? So you need to give them tips, strategies that can work best for your child. If you've observed them, okay, if your child likes, of course, every children have their favorite thing or favorite reinforcement or whatever, that whenever you tell them to do something, they cannot say no. You want them to sit down for 5 minutes. If your child is ADHD, then you can set a timer. If your child is autistic, you tend to socialize with them, take them out. If you feel like your child cannot socialize with other kids, this is not the time for you to put them at home. You need to arrange a play date for them, take them on the park, and all these things as well can help as a strategy for your child. Also, you need to also know how to work to positive. Everything is about positive reinforcement. When they do something good, praise them, reward them. Even if they are not doing, you need to be able to teach them some certain things, to do. If you want them to get to tidy up and they are not tidying up, then you tell them, okay, you need to tidy up now. First tidy up, and then we can go out for shopping. First do this, and then we can do that. So these as well can help the strategies to keep in check. But for ADHD, one of the most important things for ADHD is to always set a timer, to always time them. You have 5 minutes to complete this. So if you finish this for 5 minutes, you're going to get this. Yes, this can help them to improve their focusing and attention skills. Also you need to know a lot of things can cause autism, a lot of things can cause ADHD. We have 4 functions of behavior. We have the attention, we have the escape and avoidance, we have the sensory integration, and we have tangible to access. So you need to understand which one is your child. Is your child escaping from task? When your child is escaping from task, what will you do? If your child is escaping from task, you ask them to do something, then you need to use your first and then but first do this and then get this. If it is for attention, you feel that your child is behaving a certain kind of attention, you demand for requests. How do you demand it for requests? You tell, maybe for instance now, and this is common for autistic children, they don't know how to express themselves, use their words. So they want something and they're crying, they're throwing tantrum. Then you tell them, you need to use your words. You teach them a replacement behavior by telling them, I need to go to toilet. I need to wash my hands. If they feel like they cannot express themselves, because usually autistic children, they are speech delayed child, like most of them are non-verbal. Most of them are not verbal. So some of them, few of them are verbal. So, you know, they find it difficult to express themselves when they needed to do something. So, but it happens whether you're a practitioner or you're a parent, at home or in the school. They want to go for a break, they will show tantrum. What will you do? I need a break. I need to time out. You can teach them this replacement behavior. And sometimes they can be craving for your attention. You need to check the environment. If it is the attention that is going to make them to, for a badly behaved, you can always ignore some certain behavior. So not all the behavior you need to give attention for autistic children. So you can ignore some certain behavior, even if you tell them to do something and they'll feel like not doing it. You can ignore some certain behavior and then you ignore for 5 minutes and then they'll be the one to come back to you. They'll be the one to come back to you. So, but with ADHD, we don't really ignore behavior, but we tend to give much more attention for them because they need it. So those two are opposites. I don't know if I've answered your questions.
Yeah, Mary. So Shilpa, it's one of the things like Mary had suggested, one of the things you could do to help your son nap. Now this depends on his age and since he has autism and ADHD, yes, it's quite going to be quite difficult, challenging. What you could do is you could give him activities that could exhaust himself. In the sense, for example, after school, check what now you have to have a consistent routine. What Mary had continuously put out, a routine should be whatever you practice with your child, whether as a practitioner or as a parent, whatever it is that you work with your child, it has to be consistent. You cannot always change it every day. It's a different thing. You cannot do it because it could not only does it confuse the child, but it also makes it difficult for either the parent or the practitioner. Now, when it comes to making the child take a nap during the day, what you could do is, like I had suggested, exhausting activities. Maybe if he's not ready to nap after school, he still has that amount of energy which he uses and is not ready to put to a rest. What you could do is, after he comes from school, make him help you with the chores. It's nothing big, something small. Maybe can you help me make the table, or can you help me take these laundries to the bedroom? Something that will burn his energy. And then maybe do an exercise after he comes, maybe may help him with an exercise. Instead of sitting with the screen or playing with a toy, what you could do is make him have his food and do an exercise, or until you prepare his or her food. What you could do is make him do some exercise, some jumping jacks, bending, cleaning up his toys. These all will exhaust him, not immediately, of course. Things take time, not immediately, but sooner or later, most probably from couple days to a week's time, he will start getting exhausted. Because if he's a child who is attending schooling or nursery, whatever it is, an educational institute, definitely that the power of his brain, what he used in the sessions in the school, will cause some exhaustion. Then when he comes home, if he feels that yes, there is some work also here, I'm doing some exercises, I'm doing some work, that will also cause an exhaustion for him. And then so later on, as you move forward after a few weeks time, automatically it will come to his brain that okay, I am getting tired. Maybe if I take 5 minutes sleep, I will be fine. So increase his nap. You can gradually increase his nap. First, you can initially talk to him, persuade him, tell him that we'll take a nap for 15 minutes only. So if you sleep for 15 minutes, I will give you a reward after you wake up. So you can tell you sleep for 15 minutes, I'll give you additional 10 minutes screen time. See what he likes, see what he prefers, and accordingly alter his rewards accordingly. Then after few days, without his knowledge, increase the nap time to maybe 30 minutes. 1 week later, 45 minutes. So see how long you wanted your child to sleep for and plan accordingly. And so I hope, Shilpa, your query is clear. And we have Ansa. How to improve speech? Now answer this. To improve speech, you need to let us know the child's exact challenge. What's the child's barrier? Is he or she facing ADHD barriers, autism, learning difficulties, or just speech delay? But you need to let us know this. But I'll just give you a general idea on this is speech, you cannot immediately make a child. Now, a child who is having speech delay, you cannot immediately make a child start speaking long, lengthy sentences or to speak for like 2 minutes and such like that. A simple way we can help a child with speech issues would be that the child, you can show some pictures. For example, let's say the child is having some favorite cartoons or such. Yeah, the child's having some favorite cartoons, and you can show some characters. Ask the child, for example, let's say your child enjoys Tom and Jerry. So you can show a picture of Tom and a picture of Jerry. Ask the child, who do you see here? Show Tom's picture. Who do you see here? The child will reply, Tom. Okay, what color is Tom? So it will start off with one-worded answers. Then later on, after a few days, in the next session when you're working with the child, ask a little bit more elaborate questions. Okay, gray, but are you sure that Tom has only gray color in his fur? What about what other color do you see? So the child will do some observation. He'll think, oh, okay, there is white. So gray and white. So he or she will increase the number of words they use. So I'll be honest with you, because I cannot give you an authentic, detailed answer, since we are not aware of exactly what is the child's barrier. So I'll share the email address of Mary's and mine, and even my WhatsApp number. So you can send in your detailed question, and we will get back to you. Moving on, we have Sulaiman. Mary, I hope you're here. So Sulaiman, I'm an
Coming.
LSA teacher. My child doesn't like to do anything other than play. And anytime I asked him to do his task, he immediately sleeps on the floor. Even if I lift him up, he'll go back to the floor.
Okay. In escape avoidance, tangible to access, and sensory integration. So your child fall under